The next instrument is CPAP. It is continuous positive airway pressure. CPAP stands for continuous positive airway pressure, and continuous positive airway pressure, it keeps the breathing airways open while sleeping, and it is indicated in excessive daytime sleepiness and hypertension and CVS diseases. CPAP is used in case of the hypertensive and CVS diseases and in excessive sleepiness. The contraindications of this machine is trauma and patients having anxiety and insomnia and poor sleep habits. It should not be used in the patients having trauma and insomnia and poor sleep habits. Another instrument is ventilator. The indications are acute respiratory failure, bradypnea, apnea, and respiratory distress syndrome. Ventilator is used for the following conditions. The contraindications are respiratory arrest, uncooperative patient, trauma or burns, and reduced consciousness. So the ventilator is used for acute respiratory failure, and it is contraindicated in respiratory arrest, uncooperative patients, and trauma or burns. The next instrument is incubator. Incubator is used for temperature, humidity, and other environmental conditions to regulate it, and it is used for premature baby and sick children. The complications are abrasions, bruises, skull fractures, and brain hemorrhage. This can occur in the incubator, so one should be careful before using the incubator. That is, the indications are it is used for the temperature and humidity, and the complications are that abrasions, bruises, skull fractures, and brain hemorrhage can occur in this condition, in this instrument. The next instrument is incubator. We have discussed this already. Okay, this is phototherapy. The indications are used for jaundice baby and when bilirubin is very high. Contraindications are that it is not should be used in case of conjugated hyperbilirubinemia and when there is congenital porphyria. If congenital porphyria is present and conjugated hyperbilirubinemia is present, then the phototherapy is contraindicated. Okay, this is resuscitation table, and the indications are when used when sudden cardiac arrest occur, and it is performed in the resuscitation table is used for the unconscious patients. Okay, so these are the instruments that we have discussed. That is resuscitation table, incubator, phototherapy lights, radiant formers, infusion pumps, ventilator machine, CPAP, BiPAP, and cardiac monitor. In the ward, ambu bag, laryngoscope, nebulizer machine, airway, and endotracheal tube. We have discussed all these. Okay, this is PEADS TOACS. This is peak flow meter. It is used in asthma and applicable above 6 years. The green shows normal, the yellow shows borderline, and the red shows dangerous. Okay. Now dry powder inhaler, we have discussed this, and it is used for the steroids or any other inhaling powders or medicines. Then we have discussed the spacer device with mask. It is used in less than 6 years for 20 seconds to 30 seconds, and meter dose inhaler is used above 6 years. Nebulizer machine, its indications are and which drugs can be administered using this machine. We have discussed already this. And the asthma drugs and the steroids can be used through nebulizer machine. The spacer device with mask is used for 60 to 30 seconds, and it is used in children less than 6 years. You should remember this, okay? And the peak flow meter is used in asthma applicable above 6 years. The peak flow meter cannot be used below 6 years, and the spacer device is used for the children with less than 6 years. Okay. Now coming towards the next instrument, that is meter dose inhaler. The indications are that it is used in respiratory abnormalities, that is asthma, chronic obstructive diseases, and to administer inhaled medications. The contraindications are hypersensitivity, patient unable to coordinate inhalation, and maximum dose has been taken. Okay, the next instrument is spacer device with mask. Okay, we have discussed here that it is used in the children whose age is less than 6 years, and the peak flow meter is used in the children above 6 years. So we will write here that use in age below 6 years. Okay. So the indications are that it helps medicine to get into lungs and to inhale something. The contraindications are that it is not used in arrhythmias, in cardiac insufficiency of the various severity, in pneumothorax, in lung bleeding, and use in age below 6 years. The complications are spacer fractures, dislocations, and bone fractures. Okay, so this is a spacer device with mask. This is dry powder inhaler. The indications are it is used in asthma and it is used to inhale drug in lungs. The contraindications are sensitivity and cardiotoxicity to propellants. The next instrument is peak flow meter. The indications are to monitor respiratory conditions such as asthma, measure maximum airflow of lungs, and the contraindications are acutely unwell and extreme abnormal respiratory rate and wheezing, that is shortness of breath. Okay, so we are having red, yellow, and green. So the green is normal, the yellow is at risk, and the red shows high rate of risk. Okay, we have discussed here that the green means normal, the yellow means on borderline, and the red is dangerous. Okay, now coming towards the dangerous. Next instrument. Okay, the instruments are covered here. So which instruments we have discussed? These are dial flow meter, and it is used to measure the flow rate of oxygen or any other thing. Then this, which is airway, and it is used in respiratory failure. Then this, which is a suction tube, and it is used when the patient is unable to cuff the secretions and decrease oxygen saturation. So this is the suction tube. Then we are having this is endotracheal tube, and this is NG tube, nasogastric tube. Then we are having nasal cannula or prong. Then ambubeg, its indications and contraindications. It is used in hypercapnia and respiratory failure. Then we have discussed this as emergency tray and all the important emergency drugs, which are epival, vancomycin, decadron, atropine, avil, lasix, adrenaline, dobutamine, and vitamin K, KCl, methylprednisolone, calcium gluconate, dextrose, dormicum, acyclovir, hemacil, gentamicin M, MG-SO4, and hepomers, that is liver tonic. Then we discussed this instrument, which is infusion pump, and it is used to deliver the nutrients. Then suction machine. Then this infant radiant warmer. Then this cardiac monitor. Then the CPAP. This is ventilator. This is incubator. This is phototherapy for jaundice baby. This is resuscitation table, and this is meter dose inhaler, and this is mask spacer device with mask, and this is dry powder inhaler, and this is peak flow meter. Okay, these are the most important apparatus or instruments that is used in the PEADS nursery and ward. Now coming towards how to take the PEADS history, let's discuss. First of all, you have to ask about the patient profile, that is the name of the patient, the age of the patient, the sex, the address, and the date of admission. Then you will ask about the chief complaints, and you will try to write it in 2 to 3 lines. For example, a patient having diarrhea for 3 days, cough for 2 days, and fever from 1 day in chronological order. Then we will write the history of presenting illness. In history of presenting illness, we will ask all the questions according to his chief complaints. For example, if he is having fever, then we will ask that what is the onset, whether it is gradual, or we will ask about the time, that at what time the fever occur, and so on. Then we will ask about the birth history of the patient, that is antenatal history. We will ask the health and nutrition. Okay. Antenatal history of the mother is asked, the health and nutrition is asked, the illness during pregnancy is asked, the infection during pregnancy, the drugs used, the x-ray, the tetanus vaccine, and the past obstetric history. Then we will ask about the natal history, about the place of delivery conducted by sterilization technique for instruments, what is the gestational time, the membrane rupture time, the labor time, then presentation and type of the delivery, and then sedation or analgesia is used in the labor or not, then the sedation, and then the complication. In the postnatal history, we will ask about the first cry of the baby, whether it is immediate, cynosed or not. Then the basic problems, that is need for resuscitation problem with the respiration and sucking and swallowing. What was the birth weight with birth injury, convulsions, cyanosis rate, jaundice fever, and procedures, that is exchange transfusion, umbilical artery catheterization, and drugs. Then we will ask about the feeding history, the onset of feeding, after how many hours, and the types of feeding, the breastfeed, the bottle feed, at what age, composition, amount and frequency, and dilution. Then we will ask about the supplements, that is vitamin or iron, then weaning when, what amount of frequency, then current diet or any change in the diet during illness. Then we will ask about the immunization history, the types of vaccine given, the age in which it started, and by whom, then the dose and adverse effect. The developmental history is asked, that is the achievement of the age various milestones, smiling, ability to hold neck, sit, crawl, stand, walk, talk, and control of the bladder and bowel. These are the normal age. The patient should be started smiling at 6 weeks, ability to hold neck at 3 months, and 6 to 8 months, and the crawl 8 to 18 months, and rolling 3 to 5 months, and stand to up to 12 months. Then we will ask about the past history, then the personal history, that is particular habits, the details of school, class, interest in studies, any missed school attendance, behavior of the child with the others. Then the drugs history, any medication used, the allergy to drugs, and history of the mother drugs. Then we will ask about the family history, age of mother, age of father, married since, and cousin marriage, parents' health, present or past. Then about the siblings, the number, the age, and the sex. Then the illness, any death or stillbirth or miscarriage. Then the grandparents, if living together in the family tree. In the end, we will ask about the socio-economic history, that is parents' education, parents' occupation, family income, house, general hygiene, source of water, and any pets at home. This is the family tree. We will draw this, that how many male there are, then how many female are there, and how many twins are there. And here we will write that they are cousins or not. And this is the sign for the twins, and this is the sign for divorce. So we will draw the family tree for the patient.